So thank you. Maybe there are somebody from the audience which could kick out the ball and come up with some of the issues they think are important to ensure that we get PrEP right, that we get PrEP services delivered in the right way, in a way which is accessible to us and fits our needs. Yes, please.
This might be very specific to the, I don't know which one of the presenters was showing adverts that they had showing other people taking PrEP. Maybe the first or second person. Ukraine? So one of you was showing adverts of people taking PrEP and how there was loads and loads of adverts. Just how did you get your country to agree to that? Because most countries have regulations in terms of advertising a prescribed drug. And I'm wondering what avenues you were using. Where were these adverts shown? Thank you.
It's about advertising in metro. Huh? That's it. It may be, I don't. Maybe it's not the question. So the advertising agencies gave us some space. It's a donation. It's a gift. And it's why we could do this campaign in the metro, because it's very, very expensive usually. So, but it was not an advertise for the medication. It was not an advertise for Truvada, Gilead. It was an advertisement for PrEP. So the concept of PrEP is not a medication, and it's authorized to do advertise about that in France.
Okay, I will ask. It was a campaign, Alliance Global campaign, but actually they did the same. They did an advertisement like take and use tenofovir or tenofovir. It's like take PrEP, so it's like take prevention.
And the next question, go there. Okay, then you first.
The governor of California just signed a bill authorizing PrEP to be delivered in drugstores without any prescription. Is it something that you support, and would you do some advocacy on that in your country?
Actually, I support this idea. So I am finished my presentation by this notice about this. So I support this idea, and I think we can do it by peer-to-peer consultation, can do it rapid testing in our community center for STI and HIV, and can continue to provide PrEP without medicine prescription. It's, for my opinion, it will be much easier to keep our clients in PrEP program and receive it very fast.
I want to say also a good effect that you can take PrEP only in AIDS hospital in Ukraine. Actually, estimate numbers of people who live with HIV in Ukraine is like more than 200,000 people, and therapy is taken by 110,000 people in all districts. So when we start project, when we start PrEP pilot in Kiev and then do it like national, or like on all country, what will we see? We saw that people who actually start to take antiretrovirus therapy because of because they live with HIV, they feel less pressure and less stigma, because now they can go to hospital to take not only antiretrovirus therapy to treat. They start to go to hospital and no one knows they took therapy or they took prevention. So actually PrEP help us to destroy stigma, and in Ukraine we need to treat people now, and to destroy stigma on people who live with HIV, it's years. And we need to treat people in this moment. So in this case, PrEP help us to provide therapy for HIV positive people. So, and we are very respect our NGOs and our communities, and we still discuss about to do PrEP, to take PrEP more easy, to take PrEP in a green line in a hospital. But for this moment or for next year, we want to do the easiest way for clients that they can take PrEP in a public hospitals.
Regarding Spain, it's not only that my personal opinion is that we should not be doing things for PrEP that we're not doing for other medical conditions within public funding and appropriate medical supervision. But one of the things we've been fighting for is to make sure that, well, we've been fighting for us collectively, because as I've shown you in Spain, we've been very late. But the fact that we want PrEP to be delivered closer to the community and to be more demedicalized in a formal sense, it doesn't mean that PrEP is not a combination of drugs that need to be monitored and need to be supported within public health systems. So common sense in how we approach PrEP delivery is very important. It gives security to prescribers, to users, and to public health sector.
I think we could at least we could start with starting kits of PrEP, like starting kits of PEP, because we have, for example, the contraception the day after, so it's without medical advice, and we could imagine the same thing for PrEP. Just to start, at least for start, we can we don't need necessarily a doctor for that.
I would also like to add, for example, we're always speaking about medical control. Really, for example, we lose our clients because they said we can take PrEP by ourselves in internet. I am use PrEP on demand. I need one bottle, for example, for 6 months. In Ukraine, you can pay $30, $40 in a bottle. So we cannot say that we need a medical control, because in 2 years we received uncontrolled situation with HIV and resistance. So my opinion, it's a great idea in California. I'm from NGO.
I mean, we also heard about yesterday how the genie is already out of the bottle. A lot of people are accessing PrEP informally already there. So if we think they should be in health services, how do we get them back there again and so on? So it's really a very interesting question there. On one hand, make it easily accessible as possible. On the other hand, how to ensure that it is provided the right manner, and also how can we get all the catalyst benefits in terms of better uptake of testing, rapid access to treatment, sexual transmitted infections are being dealt with, and so on. But we will have to continue that discussion, I think, in the groups. I will move on to our friends at the Facebook, because we have a question from the Facebook.
Can I just do one tiny interruption? It's Gus here. On the first night, we were given some information about the California prescription thing. It's not going to be like aspirin. You are only entitled to one prescription for 60 days. You have to come along with a recent negative HIV test, and you won't get a second lot unless you come along with proof that you've seen the doctor again after 60 days. So it's not literally over the counter, just to clarify that.
Us for that clarification. Mark, you had somebody from the Facebook wanted to... No, it's done. He left. She left. But we have a question here from Russia, I think.
I will translate.
У меня вопрос к Виталию и, может быть, к остальным участникам. В странах постсоветского пространства очень высокая стигма, которая очень сильно влияет на людей, которые хотят использовать ПрЕП. И это очень большое препятствие к тому, чтобы люди пришли в спеццентр и получили таблетку.
So the question to Vitaliy and maybe others in the post-Soviet countries, there is a high level of stigma towards the people to the HIV positive people who receive treatment. So there is a barrier for people who want to use PrEP to come to AIDS centers because of this stigma.
И насколько я разговаривал с моими коллегами из Грузии, я так понимаю, что есть такая же проблема в Украине. Людей очень много теряется на этапе, когда они хотят использовать ПрЕП, но им нужно обязательно идти в спеццентр. Вопрос мой заключается в...
And I spoke with the Georgian friends, and I think it's also the case in Ukraine. There are a lot of people who are lost from the program because they don't want to go to the AIDS center because of this stigma.
Мой вопрос заключается вот в чем. Какие принципиальные проблемы и сложности существуют с тем, чтобы таблетки могли, люди, которым нужен ПрЕП, могли получать таблетки в НКО? Какие принципиальные проблемы в связи с этим?
So the question is, what is the real or the problem in the principle that prevents the possibility of receiving PrEP in the community-based settings?
Okay, it's working. Like at first in Ukraine, we think that the most important prevention for us is treatment. So, like I told before, it's undetectable and transmittable, and we should cover more people with antiretrovirus therapy for treat virus, and PrEP help us to do discrimination less for people who live with HIV. It's first so we use PrEP for it. Second problem that actually to take PrEP we use WHO guidelines, and in WHO guidelines you have some numbers of analysis, and in Ukrainian rules NGOs, it's not a laboratories to do analysis inside of them. So NGO cannot do blood test, like creatinine test, and actually we have some barrier. We try to work with it. Like social workers also cannot do tests. Test is made only by person, and it's called self-testing. And if person does self-testing, it cannot be identified for doctors like a result of HIV status. So. And third barrier, NGO don't have, so we have some rules where can be antiretrovirus therapy, in what place they can stay. And it should be like, it's like, maybe it's like not, we should change it, but now it's like a lot of rules. Where can we keep antiretrovirus therapy drugs and who can prescribe it? But I also can tell that in Ukraine we have some models when clients did a creatinine test in a private laboratory, take it, and then doctor came to NGO and do rapid test. But it's like, let's say it's in a gray zone. And normally we are like try to do easiest way for patients to take PrEP from a public hospitals. And the last sentence I will say, in Ukraine we spoke a lot about it, that actually sometimes, it's only, it's not official meaning, it's only like my opinion, and some of people are agree with me, some no. But when we do all prevention service are extremely easy for our clients, actually we do our clients very impotentic, our community impotentically. So in Ukraine we do tests everywhere, we do everything for free, and people don't respect it. To take PrEP, it's take pills. To take pills, you should do something. You should do analysis, you should visit doctor. If you don't want to visit doctor, you will not take pills. If you want to be vaccinated, you should visit doctor. You don't want to be vaccinated, you sit at home and don't go to school. So it's something, it's not about only, it's not a game in one wall. It should be co-working and respect all players. And medicine staff and public hospitals are one of the main player in a PrEP game.
Thank you, Vitaliy. I think you made your point. I'm sure that it's not everybody who have the same point, but we need different point of view. Thanks. I think I will move on to George from Georgia. I forgot to come back to you before, so please.
Yeah, thank you for your presentation. So my question is to those of you who address the chemsex issues in your program. So the question is about when we talk about drug use, obviously, on one hand, people are exposed to the risks or health complications related to the drug use, and on another hand, they are exposed at least to the social marginalization, and in case of some countries, to the criminalization due to the drug use. So if you have some experience to share, how do you address, on one hand, the safer drug consumption practices, and on another hand, in your advocacy work, if you also cover the drug policy related work? Thank you.
In Ukraine, we have NGOs that do prevention, chemsex, drugs prevention. They have a drugstore. You can find in internet pages like drugstore or QA. It's an internet page, and they have a booth, and it's like they have a bus, and that bus like with water, with pills, and it's like take us. People look at it like that bus looks like they deliver drugs, and it's like a prevention bus that go to techno parties in Kiev, and like during night techno parties before entrance they can consultate and prevent, like do HIV test.
Thank you, Vitaliy. We have two more people who want to ask questions, so please.
Yes. Hello. Forgive me if I missed it, and it was also already discussed. I just joined today. My question is about PrEP among people who inject drugs, drug users community, not chemsex community as such. So what's your opinion? I know it's very complicated in many ways, but what's your opinion? What's the perspective you have in your head?
Yes, please. Who want to go for that?
At the spot, we have for screening, we have many drug users which come from hepatitis or HIV tests, but until today, there are no succeed in include them in a PrEP pathway. It's maybe today we are working most about access to hepatitis C treatment and HIV. In Marseille, we have no new case of HIV new contamination for drug users by injections. So. In France.
Thank you, Sarah. Let's move on to the question there. I've seen there's one more, but we also need to sing a song soon. So,
my question about so in Ukraine, as I understood, patients can so people who are interested in PrEP, they can get PrEP medicine from the AIDS center. They cannot get it from other pharmacies. So what about Poland and Spain? So people who are prescribed drugs, prescribed PrEP, they can go to the pharmacy and buy, like in Poland, because it's they can buy in any pharmacy. It's available in any pharmacy.
They can buy it at any pharmacy. At any pharmacy that has this reduced prices, we tell them where to go. They're usually nearby the PrEP clinics. So whatever. So when we set up a PrEP clinic, we already talk with 2 or 3 pharmacies around to stock up, to pile with TDF FTC.
So if the person is interested in PrEP, when he is attending the clinic, or the general practitioner, the person has to provide ID documents, so he has to be registered in the system or not?
As any patient, he has to provide an ID, but we do not report it like to any authority. This is just our patient with confidentiality and everything.
Okay, so do government collect any information regarding how many patients received PrEP, or do you have any information to, to analyze data longitudinally?
Yeah, I told you about this Ministry of Health allowing us to look into the prescription data, but we analyze it only anonymously. But yes, if they wanted, if some bad government came to power, they could basically check by social security numbers or whatever you use to check who is buying what, yes. Because they are sold at pharmacies.
Okay.
But they are not doing that right now.
Yeah, and how it's in Spain?
Sorry, we have to stop now.
Okay.
Sorry. Yeah. The very last question now.
Здравствуйте еще раз.
Hello again. I would like to ask a question to our Ukrainian colleagues who have made a presentation. And today there have been many questions about sex workers, and in fact we more or less understand that we do have access to PrEP, although this is a limited access to PrEP. But I do have a question. Do you plan to work with people in prisons? Because there is a category of LGBT and MSM who have been imprisoned. And as far as those people are concerned, they're many times victims of violence, and we cannot possibly say when they are going to fall victim to violence, and those acts of violence are unpredictable. And moreover, in prisons, they're also delivering sex services. So do you plan to reach out to the imprisoned people?
I will translate in brief. So we heard about the sex workers. We now understand in Ukraine. We understand there is some access, even though not very wide. But what about the people in prison? We know there are people, the MSM, LGBTI people, and sometimes they also provide sex. I mean, they're also exposed to violence, and there is also sex work in the prison. So are you planning to work or to do some work on PrEP access in the prisons?
Correct. He not have condoms in detention center or jail. This is a big question because 55,000 persons sit in the penitentiary system, and this is people. It's not protected, and the big risk about HIV for these persons because the doctor don't help because stigma and discrimination is more higher for in the freedom. Thank you.
I will try to answer, and I will start answer from our logic. Our logic was to start and to provide PrEP for MSM and to do accent on MSM because it was the easiest way to start project because MSM was the most prepared group for PrEP. Next step for us is to include more sex workers in a PrEP project, and now it's like MSM in discordant couples majority. And next, in 1 month, we will have a small conference with the sex workers. We start to include more sex workers and more sex workers NGO to PrEP campaign and that kind of prevention. Then I will answer about a penitentiary system in Ukraine. So it's difficult question because at first Ministry of Healthcare not cover and not do healthcare is like other part of healthcare system in prisons, but it's not a question for this year for sure. And but to protect also penitentiary system in Ukraine, I want to say that they start to do routine testing for everyone who is in prison, and they cover around more than 90% of prisoner who is with HIV took antiretrovirus therapy. So it's like in prison it's undetectable and transmittable, and they treat people with HIV positive status, and actually it's like one of prevention in prisons. And about PrEP, complicated questions and questions for not for this year. We will think about it. We will have a consultation with other ministerium that actually do healthcare, are healthcare provider in prisons in Ukraine, because we have a specific system of healthcare system in prisons.
Thank you, Vitaliy. Why is it always that the most interesting and complicated question comes up when you don't have time to really discuss them? But we do have the working groups afterwards here where these discussions can continue. And I think that Gus would like to repeat again how it works. Thanks.
Okay.